Assalamualaikum doctors. In this video I am discussing a communication about consent related, that is exchange transfusions. So as usual we start with IRCAP. I am here to take with you about some of plans we have for Ali, and hopefully by the end of the meeting we can take your consent. But first tell me, how much do you know about his conditions? So mother is telling blah blah these conditions. Okay, would you like anyone to be here? No. Actually, that is why our consultant asked us to talk to you to take a consent for doing a procedure called exchange transfusion or changing his blood. Have you heard about it before? No, I didn't. So it is a procedure through which we will put a small flexible tube through his blood tubes in his belly button after applying a cleaning lotion. So what are we doing? This procedure, we are putting a small flexible tube through which blood tubes in the belly button after applying a cleaning lotions. Also we have to fix it in plain by sutures. And we will take an X-ray picture to make sure that it is in the right place. Are you with me? Okay, doctor. And after we make sure that it is in the right place, we will remove the blood loaded and with high yellow pigment, and we will give him a blood without this yellow pigment. Okay, doctor, any alternative? So there is a medicine called immunoglobulin, but it can cause severe allergic reaction, and this is not could be predicted. Okay, then not light therapy. So unfortunately, the level of yellow pigment in blood is very high, and we need to do it as soon as possible. Why? As this yellow pigment that is called bilirubin, if it increase, will cross his brain, and unfortunately, if this happen, it may cause some really catastrophic effects. Like, I am so sorry to tell you that if this level is very high, it may make him not to be able to move. He may not able to speak. He will have some learning difficulties, and that is why we need to do these procedures. Are there any drawbacks? Definitely, for any procedure, there are some drawbacks. First of all, there is a risk of catching bugs, but as I have mentioned, we will apply cleaning lotions and it is done under complete cleaning measures. Also, there is a risk of misplacement, and that is why we will take a X-ray picture of his tummy to make sure that it is in the right place. Also, there is risk of displacement, and that is why we fix it by suture. Adding to this, some children later may have a blood clot in the blood tubes of this liver, and we will follow up him, and this happen will interfere immediately. So is he will suffer from the pain? Luckily, pain sensation is belly button is very minimal. Do you guarantee that this blood is safe? We need to do the blood test for you and your baby. We are sure that it is safe. We get it from the blood bank where it is screened for most of the bugs. Can I attend this procedure? Actually, it is a very long process, exhausting you physically. You can follow us through window, and we assign a nurse to explain for you step by step. Finally, it is your decision if you want to attend. Okay, I will take 1 or 2 days to think about it. At the matter of fact that we cannot wait for 1 to 2 days. It is really urgent. You need to think about it within the minute. Actually, we can give you some leaflets about it. You can revise them and must tell me your decision as soon as possible. We cannot wait. I am so sorry. If we wait and the level of the yellow pigment continue to rise, it will cause the catastrophic effect I have mentioned. Can I attend during the procedure? Best not attend for better infection control, but you can follow the procedure from a window, and there will be a nurse with you, will explain every step. Okay, I will think about it. Great, and please, if you have any question, you will find us here. Do not hesitate. I will give some leaflets and read them quickly, waiting for you decisions as soon as possible. Then trusted website leaflet design. So what we understand from exchange transfusion communication, that is, will a small flexible blood tube we enter into the belly button blood tubes of the children, and we'll fix it by sutures and taken a picture of X-ray. First it will settle here, and then we will be replace the yellow loaded blood of the babies with the blood that is, we will give the blood that is without yellow pigment. If parents ask, alternative is immunoglobulin, but it has severe allergic reaction, that's why we avoid it. Why we are not giving light therapy? Because his level of bilirubin or yellow pigment is that level high that it can not controlled by light therapy, and there is a chance to cross the enter into the blood. If it enter into the blood, catastrophic effect occur. The child may have walking problem, learning difficulties, lots of effect. That's why we are doing this. What is the side effects or any problem? It can be infection occur. So if infection occur, we are already taking it a very hygienic measure, and sometimes there is clot occur after the procedure, we will be interfere immediately, follow up her. Sometimes the sutures, the blood tube can be displaced, but that's why we are suturing this blood tube on the place. Then telling that 1 to 2 days she must take. It is very emergency process, just 1 hour we can give. Mother, if you want to watch that it is really exhausting, you cannot present, you can see on the window, and nurse will be tell you, though it is very exhausting process. So it is an urgent procedure. Within we can give only 1 hour for these conditions about that. Thank you.